This next group of drugs are called bile acid binding resins or bile acid sequestrants. And we had talked about them in passing in a previous case. And I didn't really dwell on the mechanism because it really didn't fit into the biology or really the case. It really was kind of an adjuvant therapy, but I just wanted to put it in there so at least you were exposed to it. We're talking about cholesterol. And so bile acid binding resins or sequestrants are really good for kind of what they deem isolated increases in LDL. And so this can be LDL increases due to a drug. This could be really just the 5 or 10% LDL increase that you see with current use of maybe 2 or 3 drugs that are well known to kind of increase the LDL concentration. Something that maybe diet can't really take care of. You can see a reduction in total cholesterol as well as a reduction in LDL as well as an increase possibly in triglycerides. And so patients that have elevated triglycerides, you probably wouldn't want to use this drug to kind of molecularly target or go after the LDL concentration. Basically, these are polymer positively charged resins that are insoluble in water. The drug itself doesn't actually get reabsorbed. This drug class tends to be quite useful for patients that have defective receptors due to some type of mutation, not missing receptors like some of these other more dramatic familial hyperglycemia. Hypertriglyceridemia or hypercholesterolemias that you can typically see. So how do they work? Well, they're kind of like scavenger molecules. They bind to the bile acids in the lumen of the intestines and basically halt their preventions because they're so bulky. Here you can see kind of a really enhanced hepatic conversion of cholesterol to some of these bile acids. So by default, or as a consequence of that, you can see a reduction in liver cholesterols. You can see an increase in the LDL receptor number expression, and then consequently you'll see lower serum LDL levels as a consequence of that. So, in terms of the therapy, it's really good to kind of get a 20% reduction in LDL. So if you've got a patient that has, just slightly elevated LDL and you need to reduce it by 20%, the bile acid binding resins would be a good alternative to a statin if they complained of muscle pain or if they were experiencing some of the side effects to statins. Typically we take this drug with meals, and from a mechanistic standpoint, we've also used these drugs to kind of be scavenger molecules in the GI system at least, to kind of bind to excess drug. And so if there's an overdose, an acute overdose of digitalis, the digoxin, we can co-administer this drug to kind of physically pull it out of the GI lumen, and that would kind of cut down on some of the experienced toxicities to excess digitalis. Because it's kind of a bulky kind of molecule, you can see some GI upset, quite common. Sometimes we'll tell the patient to kind of combine this drug with kind of fiber or psyllium. Psyllium is like Metamucil. This drug does, however, interfere with many of the orally administered anticoagulants. So you are going to have to kind of monitor changes in prothrombin time. And you can also see malabsorption of certain fat-soluble but also water-soluble vitamins and minerals and so forth, particularly folic acid, which is quite possible. There's basically 3 preparations available. We had talked about cholestyramine in one of the previous cases. Excuse me. They're more or less the same. There's minor clinical implications for the different formulations or preparations that are available. Okay, so we'll end there with the bile acid binding resins.